Good evening, my name is Johannes Smith. I am the wife of our veteran, highly decorated. Unfortunately, my husband, who passed away, he didn't come back alive from Buenos Aires, Argentina, because tragedy treatment, hemodialysis treatment. He was in dialysis already for 6 years, starting in 2006, I believe. And unfortunately, because of brutality and criminal negligence down there, he was dialyzing to a very prominent company where he was even dialyzing all over the world, everywhere, from Germany, Brazil, multiple countries, the US and everything else. He was a very good dialysis patient, and he has a good hemodynamic. He tolerated dialysis very well, good tolerance. This poor patient died because of sabotage in the dialysis from poor ultrafiltration, bad hemodialysis machines. They couldn't coordinate and calibrate properly, and that will be alert other tourists to travel to be careful where they travel for dialysis treatments. In this case, we traveled to Buenos Aires, Argentina, and like I say, we used to travel all over the world and dialyzing from a very prominent company like Fresenius, and we never had no trouble at all. It's a very good company with very good reputation. Unfortunately, this treatment didn't turn out to be that way. This treatment was a disaster. My husband has a pulmonary edema. I have the records there from all the medication they give him from pulmonary edemas. I was paying tremendous amount of money for hospitalizations and even dialysis treatments down there. They took him out of the hospital, saying even the bronchopneumonia was treated and everything else, no? Was a real disaster because he has a terrible pain in the back of his lungs because all the fluid I could see all the fluid in his tissue. Why this patient was leaving all the toxics and fluid through his systems? Because the parameters they couldn't coordinate. They was preventing a good ultrafiltration. They was going up and down, up and down, up and down to a higher numbers, 220 to 290, blaming ignorantly the axis of the fistula. The axis of the fistula didn't have nothing to do because the axis was already looked by very prominent physicians down in Seattle, Washington, was in Buenos Aires, Argentina by the Britannic Hospital, and I have the video from his fistula axis, and they blaming his bad parameters and everything else just because the dialysis filter. I would like to mention, please, to alert other dialysis patients from all over the world due to the facts I couldn't save my husband's life, right? And my husband was a person who I love with at the most, and he died because of brutal treatment and criminal medical negligence. Up to a point he was bleeding from the rectum because of bad dialysis. Each time we got out the treatment, he was bleeding everywhere in the hotel, the towels, the toilet seat, and I didn't know what to do. He screamed for help to few physicians. He recalled to a Dr. Vilche. Please help, Dr. Vilche. Please help, Dr. Vilche. I am dying. Nobody seemed to assist us in this matter. He was dying in October the 1st, just one day prior us leaving the country. This patient developed a CHOP septic where his blood wasn't getting oxygen because it was all contaminated. We request this play to save the blood, and they throw it away, and I sign it for them to be requested because they only give me my husband's body. He just died. He went into pulmonary cardiac arrest and a CTC. It's the only explanation they give me because pneumonia is what they claiming was more than just pneumonia. I mean, was intoxication of his system. He got paralyzed. He was vomiting. I have record he was vomiting. The poor patient went into colonoscopy because blood everywhere in the hotel room. Parameters badly coordinated. Records here. Was a patient this type of patient was not only dangerous not to dialyze him well, not just only because the electrolyte and the renal failure, no, like WM was going out of control, is why they was blaming the access. Phosphorus was going out of control, they was blaming me because his diet. That they were so ignorant and they couldn't see the machine wasn't working. Even the gaximeter, I reported to the doctor, and the gaximeter wasn't even working. So they did a lot of brutalities, a lot of salvage things to this poor war veteran who went to dialyze there, who fought for the freedom of women and children and protect others people's rights. And it's why I am fighting for him now, because I think he deserves good treatment, not only because he was a war veteran, but because he was paying tremendous amount of money, like a $7,000 a month for his treatment down there, 436 Entre Rio, Buenos Aires, Argentina. This was a fraud, and it's what I want to alert other dialysis patients to prevent and losing their life, and to prevent and getting fraud in the treatment. That Miami hospital clearly stayed, as such a good hospital like that. We did a pacemaker surgery just 6 months prior to his death, with the same disease he has, with the same medication he has, and he still make it through. Didn't have nothing to do with no able not to because all his other illnesses, but because the dialysis was the major core in keeping him alive. If the dialysis wasn't good, he will die automatically. That was his major life support. So that will alert to other dialysis patients to be alert how you get dialyzed. Do not put attention to your prescriptions. Make sure they don't sabotage your machine. Make sure the conductivity doesn't go back and up and down. Make sure that the parameters, they don't go up and down all over the place, because that prevent good ultrafiltration. Or even if the conductivity go up and down, that will prevent you a good ultrafiltration. And it's very dangerous and can make you very sick and ill, because depending if you taking furosemide and digoxins and a lot of other numbers of drugs, they can be dangerous to you if you don't get adequate good ultrafiltration, good disintoxication of your system, and good fluid removal. Can mean you can go into a CHOP septic if your blood doesn't get clean, if the drugs are out of control. That can go into a CHOP septic. What happened to this war veteran, my husband Robert John Smith. I did whatever was possible to provide him a high care. Is why we was paying that amount of money, and because all the fluid they was living in his tissue, in his lungs, will be no affect only his lungs, but he could go into congestive heart failure. Is why the Miami hospital clearly stay is a patient who has electrocardiograms. They was very normal back there, very good electrocardiograms. Is a patient who chose all the tests to be normal as well, right? So right ventricle, left ventricle, right ventricle, all the reports here. Why this patient went into a tragedy there? Because of brutality, gross negligence from the doctors from Favalolo institution who are working in the Frisinia, Belgrano, Entre Rio. A brutality, criminal negligence. They could prevent this CHOP septic or pulmonary cardiac arrest if they perform a good dialysis treatment, and by fluid overload, like I say, It's why some of the chest x-ray is showing he was going into congestive heart failure, because it's writing his report here. If this patient doesn't remain in the dry way, this patient can go into congestive heart failure. Based on this patient clinical state, it's very clearly the cardiology. In any cardiology, he was reassessed from him before. They highly recommend to keep this patient in the driveway. And those ignorance there, because the brutality they did, the criminal negligence, they didn't do it, and result into this poor patient's life. I told them to keep the blood because 15 minutes after the patient, 15 minutes only after the patient left the center, this patient started screaming for help in the sidewalk. They couldn't even reassess him inside the unit, but in the sidewalk, this patient started screaming for help and say, I cannot breathe, I cannot breathe, please help me, I cannot swallow. I was giving him a sip of a little juice and he couldn't even swallow. He got paralyzed from his yacht, he got paralyzed, all internally, and he said, please take me to an emergency, I am dying. He died in the 29 in the Britannic hospital, and he told me, I feel better here. I am not feeling so intoxicated like when he died in this Favalolo institution, what they are the major cause of my husband's death by criminal negligence, and they could prevent. They have signs. We told them. I tried even to make an appointment with this medical director there. He never called me back to the hotel just to tell him he was bleeding everywhere and everything else. He never replied me back. Their comments is urea high, the access, you see, blaming the access. Here is the evidence where they blaming the access about a stupid machine who was badly calibrated, badly in very bad shape, and they wasn't calibrated properly, and then the poor patient was living with intoxication and fluid overloaded. So it's why this patient, the big tragedy occurred just one day as in prior leaving the country, October the 1st. That was a terrible. The heparin was getting very high into his system, up to a point he was bleeding from the rectum, right? The parameters are showing to be 200 to 220 to 200 venous pressure, arterial pressure 220, venous pressure, what is very important, was 290. I couldn't believe it, because of bad coordination parameters from a bad equipment. It's a brutality. Why he was accumulating even the heparin, when they was only giving such a small amount of heparin, and everything was going out under control. Urea was going under control. All these records, here is a record of all the medication he was taking. That will alert other dialysis patients to be careful, because you can get robbed, they can commit fraud to you, and on the top of that, they might scam your money and steal fraud your money, and you might still dying, because dialysis is a major treatment for life support. And in this case, they play with somebody, with my husband's life, paying tremendous amount of money, leaving all the fluid, what that will cause him a congestive heart failure. Thank you very much, and bye. I hope that will be good to you.